mind that Joe Rogan just yesterday admitted to taking ivermectin.
Ivermectin is something more often used to deworm horses.
CNN is saying I'm taking horse dewormer.
Rogan telling his 13 million Instagram followers that he was treated with several drugs, and he included ivermectin on the list, a drug used for livestock.
Rogan said the word ivermectin. Yes, that's the deworming medicine made to kill parasites in farm animals.
Why would they lie and say that's horse dewormer?
So things are clearly bad, but they're being made even worse.
Ivermectin. Man, has it been a crazy journey with this drug. Not only were we being told that it is a dangerous drug to take, but we were being told that it was a horse dewormer, that people were dying and hospitals flooded with people who were following misleading people like Joe Rogan, who was administered ivermectin and prescribed it by a doctor. See, what they didn't tell you at the time is that studies were happening at the very same time they were spewing propaganda that were proving that ivermectin was in fact effective against COVID-19. Now, many of you remember this. It's not been that long ago. Surely you were alive during the pandemic, probably locked in your home, potentially threatened with force or being arrested and detained for leaving your home, especially if you were unvaccinated and unmasked. Many of us faced the wrath of not wearing a mask because we had done our research and knew that the masks were not effective at even containing particles from a vape. Furthermore, it was not effective at preventing the spread of bacteria, COVID-19 specifically. Pathogens, that is. So we've come a long way. It's been a long road of propaganda, censorship, and mass disinformation. The corporate America that we live in, run by the pharmaceutical industrial complex and the medical industrial complex, and we added that the insurance industrial complex. They're all in bed together with the government. Many of our government officials are bought and paid for by these very institutions. Now, the clip that you saw just at the beginning, that should remind you of how violent and how hateful the rhetoric was during COVID. Joe Rogan was prescribed ivermectin by his doctor. CNN ran morning to night, 12 to 12, propaganda against Joe Rogan, even going so far as to, as you saw in the video, or will see in the video, so far as to modifying his skin tone in the video to make him look green, like he was on death's door. If I'm not mistaken, he was actually getting out of an ice bath at the time. He took his medication that he was prescribed. He said he did not feel well while he had COVID, but he recovered quickly. This was under his doctor's supervision. So as time's gone on, the data's come out, doctors who were censored heavily, this is Dr. Peter McCullough, Dr. Robert Malone, and a number of others, have come forward and were coming forward during COVID. These are specialists. These are well-recognized, highly reputable, world-renowned doctors, immunologists, virologists, and they were censored, blacklisted, and they went so far as to create effectively an information war army that served the purpose of the pharmaceutical industrial complex. We'll get into that in a minute. We'll finish this video, but the information that we're going to look through today, it is not only shocking because we're going to look at articles that were published during COVID, the pandemic, FDA, CDC, and the way that they referenced ivermectin, the way that they framed the article that was really more of an opinion piece aimed to slander the drug that has been around for decades, 1987 to be specific, and it has saved potentially billions of lives. I say potentially, I don't have the exact number. So we can guarantee it saved hundreds of millions of lives. We're going to get into all of it, and I cannot wait to go through the information. If you haven't seen it, this might very well be one of the most eye-opening videos you've ever watched. I'm happy to do it. If you could, like and subscribe. If you're on YouTube, that is. If you're not following on X, follow there. We actually shoot live and live stream every day, the Archer Angle, which is effectively covering the news the media will not touch. Something I take a lot of pride in is doing what I'm doing today, So I won't go any further. We'll get into the data. We'll get into the articles. And yeah, we'll reconvene once this video is over. This is prime time media brainwashing, neurolinguistic programming to be specific.
It blows my mind that Joe Rogan just yesterday admitted to taking ivermectin.
Ivermectin is something more often used to deworm horses.
CNN is saying I'm taking horse dewormer.
Rogan telling his 13 million Instagram followers that he was treated with several drugs, and he included ivermectin on the list, a drug used for livestock.
Rogan said the word ivermectin. Yes, that's the deworming medicine made to kill parasites in farm animals.
Why would they lie and say that's horse dewormer?
So things are clearly bad, but they're being made even worse by people who have refused to take the vaccine and instead are swallowing horse paste.
Wait a second. He said that he got better because he ate cattle dewormer.
They must know that that's a lie.
You have individuals like Joe Rogan, for example, who don't want to take an experimental vaccine but will take horse dewormer.
Well. If it isn't old horseworm Rogan.
Ivermectin is often used to deworm livestock.
Ivermectin, apparently given to deworm animals.
It's a lie on a news network, and it's a lie that's a willing. That's a lie that they're conscious of. It's not a mistake.
Yeah.
They're unfavorably framing it as veterinary medicine.
Joe Rogan, he came down with COVID. He says he's been taking the livestock dewormer ivermectin.
They lied and said I was taking horse dewormer.
Ivermectin is a drug that is commonly used as a horse dewormer.
They keep saying I'm taking horse dewormer. I literally got it from a doctor.
You know what doctors say? Doctors say you could take it for humans. Yeah, but not for coronavirus.
He may not have gotten it from the feed supply store, but it's the same compound.
When you have a horse deworming medication that's discouraged by the government, that actually causes some people in this crazed environment we're in to actually want to try it. That's the upside down world we're in with figures like Joe Rogan.
Bro, do I have to sue CNN?
He also acknowledged taking a controversial treatment designed for animals.
Does it bother you that the news network you work for out and out lied, just outright lied about me taking horse dewormer?
They shouldn't have said that.
Why did they do that?
I don't know.
Yeah. So when you look at something so damning as that, these people knew. We're going to look at something here in a minute that should make your heart break. For one, because they were preventing ivermectin from being used. Doctors were not prescribing it. We know why. The problem is there are so many people during the pandemic who, one, died because they didn't have effective treatment. Early treatment with ivermectin is extremely effective. This is data published by world-renowned organizations. But they were intubating people that could have been perfectly fine. And if you look at the fatality rate of people who were intubated, it's unbelievably distressing. So they had, look at Trump. He was 75 years old at the time, 76, I think, and maybe 73. But nonetheless, he overcame it. I remember the day he was diagnosed with it. And he took an effective treatment, a couple of drugs, and he got better. Joe Rogan did not take horse dewormer or horse paste like CNN would have you believe, and all the rest. He took ivermectin for humans and got better. So it's just disgusting. But it's always good to reflect on these things, especially when the FDA is now having to remove all of their anti-ivermectin propaganda. It's a very sweet victory, my friends. But first, we have to look into the actual propaganda that was being spewed during COVID. This is from the Food and Drug Administration. This is our country's trusted source for approval for, well, not even yet, I don't believe, supplements, but food and medication. Why you should not use ivermectin to treat or prevent COVID-19. There's a horse here with probably a veterinarian and a doctor with a patient. Make no mistake, I think what they did here is ridiculous, but it's also shameful. Complete disregard for health here, and they didn't trust Fauci. She didn't, because guess what? She's not wearing a mask. She could kill this horse. The horse should be wearing a mask too. I think it's so disrespectful to fly in the face of science like this. She and horse should both be wearing masks. Otherwise, they could catch COVID. It's so horrible. Now, COVID-19. We've been living with it for what sometimes seems like forever. Given the number of deaths that have occurred from the disease, it's perhaps not surprising that some consumers are turning to drugs not approved or authorized by the Food and Drug Administration. Okay. One of the FDA's jobs is to carefully evaluate the scientific data on a drug to be sure that it is both safe and effective for a particular use. In some instances, it can be highly dangerous to use a medicine for the prevention or treatment of COVID that has not been approved by or has not received emergency use authorization from the FDA. There seems to be a growing interest in a drug called Ivermectin for the prevention of or treatment of COVID-19 in humans. Here's where it gets tricky. Certain animal formulations of ivermectin, such as pour-on, injectable paste, and drench, are approved in the U.S. to treat or prevent parasites in animals. Now, they do touch on the human component, but they never would fail during this period to first emphasize that it's used in animals. Now, here's where the fear-mongering comes in. However, the FDA has received multiple reports of patients who have required medical attention, including hospitalization, after self-medicating with ivermectin intended for livestock. It would be very interesting to see how many people were actually hospitalized, because just like the gunshot victims, they were saying that the hospitals were overrun, that they were going to have to turn patients away because they had no beds available. But then we were seeing nurses in mass, 24 nurses in a hospital in the hallway during COVID, dancing like they were on Broadway. Complete bullcrap. And you know we have to touch on CNN. FDA warns against using anti-parasitic drug for COVID-19 after reports of hospitalizations. This is March 5th, 2021. This is during the heat of the war on ivermectin. The U.S. Food and Drug Administration on Friday said that people should not use ivermectin to attempt to treat or prevent COVID-19. This drug is typically used to treat parasites, such as lice and scabies. Now, they did touch on the human component, but they did not say human in here. This is the critical component here, is because the people who read CNN, the people who listen to CNN, they are in a state of mind where they have been programmed neurolinguistically through years of brainwashing and trusting the media, that the media knows exactly how to hit that trigger. They know that what they're about to say is going to push them just in the direction they want them to, and it could be the omission of a word or the addition of a word to slant that person in the direction that they want them to go. And it's the way they frame it. There seems to be a growing interest in a drug called ivermectin to treat humans with COVID-19. Ivermectin is often used in the U.S. to treat or prevent parasites in animals. So there it is. This is the emphasis. The FDA has received multiple reports of patients who have required medical support and been hospitalized after self-medicating with ivermectin intended for horses. So there's the fear-mongering. And they continue to go through here and not ever talk about the effectiveness of the drug ivermectin that has been widely touted as potentially the safest drug ever produced. So the whole article is effectively pushing the narrative that ivermectin is dangerous, not that it is potentially helpful. They never touch on how it's been used for decades. What do? Expose it. That's about all we can do. Thankfully, this video should stay up on YouTube, considering the fact that now the news has come out 3 years later. So now we get to the good news. The Gateway Pundit reports, the FDA loses its war on ivermectin, agrees to remove all related social media content and consumer advisories on ivermectin usage for COVID-19. Interesting. December 2021, the FDA warned Americans not to use ivermectin, which is intended for animals, to treat or prevent COVID-19. Never use medications intended for animals on yourself or other people. Animal ivermectin products are very different from those approved for humans. Use of animal ivermectin for the potential or for the prevention or treatment of COVID-19 in humans is dangerous. There have now been 101 ivermectin COVID-19 controlled studies that show a 62% lower risk in early treatment in COVID-19 patients. So how do we get this passed? How does this happen? A group of brave doctors had filed a federal lawsuit against the U.S. Department of Health and Human Services and the Food and Drug Administration over the agency's unlawful attempts to block the use of ivermectin in treating COVID-19. Believe it or not, that was filed in Texas. So they were, as these doctors said, that the FDA overstepped its authority and unjustifiably interfered with their medical practice. So they were, a point to note here is, if you remember or if you didn't know, during this period of time where all of the ivermectin was stored, we were seeing labs that were getting torched to the ground. And additionally, all of the ivermectin that was in the United States, or a large part of it, was sent overseas, namely to Africa. Quite a coincidence. Now, this is where things get really hairy for the narrative. This is the Journal of Antibiotics. Ivermectin, enigmatic, multifaceted wonder drug, continues to surprise and exceed expectations. Over the past decade, the global scientific community have begun to recognize the unmatched value of an extraordinary drug, ivermectin, that originates from a single microbe unearthed from soil in Japan. Work on ivermectin has seen its discoverer, Satoshi Omura of Tokyo's prestigious Kitasato Institute, receive the 2014 Gardner Global Health Award and the 2015 Nobel Prize in Physiology or Medicine, which he shared with a collaborating partner in the discovery and development of the drug, William Campbell of Merck and Company, Incorporated. Today, ivermectin is continuing to surprise and excite scientists, offering more and more promise to help improve global public health by treating a diverse range of diseases. With its unexpected potential as an antibacterial, antiviral, and anti-cancer agent being particularly extraordinary. Now, the history of this, we won't dive extremely deep into it. We'll look at the numbers. Drug's potential in human health, it was used on animals starting in 1974. And they were found in 1974, and the ivermectins were found and named in 1975. The safer and more effective ivermectin was subsequently commercialized, entering the veterinary, agricultural, and aquacultural markets in 1981. 1987 is when it's provided free of charge and to be prescribed as much as needed and for as long as needed for humans. It was used mainly in river blindness to begin with, onchocerciasis, but it's river blindness. This is its main purpose. It was a very widespread illness, which was among poverty-stricken populations throughout the tropics. These are people who were suffering tremendously. This drug saved so many people's lives. The numbers on that, shocking. Perhaps more than any other drug, ivermectin is a drug for the world's poor. Most of this century, some 250 million people have been taking it annually to combat two of the world's most devastating, disfiguring, debilitating, and stigma-inducing diseases, elephantitis being one. River blindness and lymphatic filariasis. Most of the recipients live in remote, rural, desperately under-resourced communities in developing countries. Now, the billions number I said earlier, how can I verify that? Well, I can't. But what I can say is how much it has been administered to those in need. We're looking at So 20 to 40 million people were infected prior to the launch of large-scale control interventions, with around 200 million more at risk of infection. Since the prodigious drug donation operation began, 1.5 billion treatments have been approved. That is shocking. Even more shocking, this takes the cake, and we'll listen to a renowned doctor to finish this off, speaking on exactly how effective it is. But this article was published during the height of all of the ivermectin scare. And look, Dr. Peter McCullough was in there. Dr. Peter McCullough, who was on Joe Rogan's podcast, and additionally, he was censored and canceled like you would not believe during COVID, during the pandemic. Ivermectin, a multifaceted drug of Nobel Prize-honored distinction with indicated efficacy against a new global scourge, COVID-19. Now, we won't run through all of this, but most important thing here, 6 of 7, actually we'll back up. Since March of 2020, when ivermectin was first used against the new global scourge COVID-19, more than 20 randomized clinical treatment RCTs reporting in 2021 found notable reductions in COVID-19 fatalities, with a mean 31% relative risk of mortality versus controls. That's pretty substantial. During mass IVM treatments in Peru, excess deaths fell by a mean of 74% over 30 days in its 10 states with the most extensive treatments. Reductions in death correlated with the extent of IVM distributions in all 25 states with p less than 0.002. Sharp reductions in morbidity using IVM were also observed in 2 animal models of SARS-CoV-2 and a related beta coronavirus. When you don't have to go off speculation and you go off data, that's when you have a leg to stand on. Because that's when you can present evidence to people who are skeptical of you and have their full faith in the government. They know in their mind that the government and pharmaceutical companies are there to help. They're there to keep you healthy. Well, that's just a major contradiction, considering they don't make money if you're healthy. They make money off of mandated vaccination. This is a perfect example. Ivermectin was effective. As time has gone on, we've seen that the COVID vaccine has been walked back from being safe and effective, and from preventing transmission and preventing you from getting it. Contraception, we could say. At the end of the day, it was a propaganda machine spewing out lies this entire time. World-renowned doctors canceled for simply stating the data. This is the world we live in. Pharmaceutical companies make money when you're sick. Therefore, their goal is not to make you well. Their goal is to keep you sick under the guise of prevention with vaccines, under the guise of resolution in getting you better when sick. You have to look at everything critically. Now, this is Dr. Peter McCullough,
which is one
tremendous.
of many drugs we used to treat acute COVID-19. There were dozens and dozens of randomized trials, observational studies that showed, number one, it's extraordinarily safe. It's safer than Tylenol through a large range of doses. And that, number two, it appeared to have a very prompt effect in helping people get through the illness. And in 3 papers...
Never saw a tirade, a brigade, a war against Tylenol, have you? I haven't.
That were summarized by first author Gukliakos and colleagues, showed that even in patients with low oxygen levels, they could promptly rebound at home and not be hospitalized. So in 2020, a prospective study was published in one of the best pulmonary journals, Chest, by Dr. Rushter and colleagues. He testified in the U.S. Senate on December 8th, 2020. And with ivermectin given in the hospital, which was easy to give orally or down an NG tube, there was a 50% reduction in Americans who took ivermectin in these Florida hospitals. So in the absence of any concerns on safety, every single American admitted to the hospital should have been administered ivermectin because it gave a chance at survival, and there was nothing to suggest that it was unsafe. Yet hospital administrators and chief medical officers and those in the hospital fought tooth and nail to be sure patients didn't get ivermectin. And multiple court cases like the one Dr. Bowden described went to court, and there were court orders to administer ivermectin. And this occurred in Buffalo, New York, in Chicago, and elsewhere. And when patients were given ivermectin, even very late in the illness, many were revived and survived. So the ivermectin story in the hospital is a very important one for people to understand.
Would you consider this crimes against humanity? How many lives would have been saved? How many lives have been lost due to medical malpractice? A court ordered a hospital to administer ivermectin. Well, anytime you see a widely accepted narrative by the media or the government, you should always question it. Under any circumstance, it doesn't matter if it is Tylenol. Anytime there is a full-blown censorship campaign, you should probably do your own research. And nowadays, after COVID, where we had lockdowns, we had mandated vaccines, we had people going to jail for leaving their home, and now we have a border invasion. Guess what? These people didn't have mandated COVID vaccines during the pandemic. These people aren't vaccinated. Many of these people are not vaccinated like we're supposed to be for measles, polio, more than likely. These are things that aren't being said. We can look at the safety and well-being of our citizens and the integrity of the coming election, but what we aren't hearing about at all, really, is that diseases are being brought across the border, and they're being let in with, up until last week, with no barrier to entry. So these things should be concerning to you all as they are to me. Most importantly, I have a huge announcement. If you've made it this far in the video, I appreciate you for getting here. Please like and subscribe, leave a comment. I care deeply about sharing information, what I see as the truth. You can make your own assessment on the things I say. I try to back the things that I say up with data. However, if you've made it this far, please like, subscribe, comment if you're on YouTube, if you're on X, repost it. Thank you for watching. On Rumble, follow the same trend. That all being said, a massive announcement that I have is I will be having Dr. Robert Malone, one of the people that I mentioned earlier. He is the developer of the mRNA technology that is found in the COVID vaccines. He patented it. The patent expired. Then Pfizer, Moderna, Johnson & Johnson, AstraZeneca, they ended up putting that mRNA technology in the vaccine. He was on a full-blown brigade against the vaccine during COVID. He was canceled in ways that I could never imagine. And I know I mentioned earlier, if you go to my X account, I'll leave a link, and you look at what the CDC did. They had mobilized doctors all around the world to be in an email list that if somebody was spreading misinformation about COVID, that was sent out to all of these doctors on this email list, and they would effectively be chased down by the mob rule. So if you want to check that out, it's on my X. But Dr. Robert Malone is coming on next week. Date and time have to be ironed out, but I'm looking forward to it. Thank you for making it this far in the video. Thank you for watching. New video will be either posted later today or tomorrow. Archer Angle will continue tomorrow night, and I look forward to seeing you guys then. Thanks. Have a good night.